The fact is that a dental implant is a pretty straightforward procedure. Most of the time it can be done under just local anesthesia. Many patients want to be sedated for the procedure, and it takes probably less than 15 to 20 minutes to actually successfully place a well-placed dental implant. A dental implant, really, just so everybody understands, is nothing more than a titanium screw. It replaces the root part of the tooth, and then ultimately, once it integrates with the bone, your dentist will put a permanent crown on the implant, crown being the tooth part, so that the tooth is functional and aesthetic.
The whole reason for your portion of your jawbone to exist is specifically to hold your teeth. When your teeth are removed or they fall out or they're no longer in your mouth, that bone starts to melt away. What an implant does is essentially tricks your body into thinking you still have a tooth there. So you have the least amount of negative effect on the teeth on either side of the implant, and it restores and maintains the bone and the tissue around the implant itself.
An initial consultation usually involves a clinical exam, review the patient's medical history. Usually we take a 3D image, a cone beam CT, and that helps us to see three-dimensionally if the bone itself is adequate for implant placement.
A lot of times we can do dental implants, what we call immediate dental implants, meaning the same time a tooth is extracted, where a tooth comes out, and so long as there's no significant infection and the bone is mostly intact, we're able to place the dental implant immediately. Worst case scenario, there's some bone grafting involved, meaning when a tooth is extracted, we have to actually rebuild the bone to some degree.
Any trauma to a tooth may be an indication to be seen by an oral surgeon for an implant. If you're missing one tooth or several teeth, that's an indication to come and see your oral surgeon. Of course, we do like to work in conjunction with a restorative dentist, and if you don't have one, we can always refer you to one of our top referring doctors.
Some of the things that people ask about dental implants and the experience with a dental implant is really what it comes down to for almost all oral surgical procedures is, does it hurt? And the answer is absolutely not. It should never hurt if you're at the right oral surgeon's office.